bringing you the people of Mississippi and the issues affecting our state. This is the Mississippi Hometown Network.
For the Mississippi Health Advocacy Program, we work for improved health policies in Mississippi, and we do that through advocacy and education programs like we're holding today.
We're here today in Jackson to inform Jackson's Mississippi leaders what people throughout the state of Mississippi think about health reform and health reform implementation here in Mississippi. Mississippi is generally regarded as first and the worst. Mississippi has a number of pressing health issues, and so Mississippi stands to gain a lot from implementation of the Affordable Care Act, and there's a number of pressing health issues on the horizon related to that implementation. When you look at it on face value in terms of Mississippi, it provides opportunity to provide citizens of Mississippi who are uninsured with health insurance and health care and access to health care. Also, when you look at new people entering the market, new people with health insurance, it's a way to drive new jobs. You need more doctors, more nurses. You would need even front desk people at doctors' offices. So yeah, I look at it as a win for Mississippi.
What is the state of the health of people of Mississippi now, and how will that be impacted by the Affordable Care Act?
Well, one of the things, when you look at all the major health statistics and indicators, Mississippi usually ranks last or next to last. But what health reform does is it provides our Mississippians, provides families with access to health care, which, the main thing is getting people into a primary care physician. And if they're able to get into a position and get into routine care, which goes well in terms of prevention, and we can start decreasing some of those staggering statistics. Good morning. My name is Corey Wiggins with the Mississippi Health Advocacy Program. I just wanted to take this time to thank you all for coming out here this morning and sort of set up and talk a little about what we're going to do today. What we're doing today is part of our overall project that we're doing here in Mississippi around health reform implementation. The project has a couple of different components. This is one of them. But some other components, we're actually doing some polling around health reform in 4 counties in Mississippi, including Hinds County, Harrison, Lee County, and Washington County in the Mississippi Delta. In addition to that, we're working with community groups in those counties as well, partnering with those groups to do work around health advocacy, particularly around health reform. What we're here today really is to do is sort of do a debrief, inform people based upon our dialogues that we've done throughout the state, what Mississippians think about health reform, what they think about health reform implementation. And we want to share that with people here so that you can use this information, take it and use it in the work that you do, and we think it'll be a very informative process for everyone that's involved.
I am Heidi Gantwerk, and I'm with Viewpoint Learning, and we are an organization that does dialogues on all sorts of issues, and we've been working with the Mississippi Health Advocacy Program to work on healthcare reform actually since 2008 in a variety of projects. Isabella Firth is also with Viewpoint Learning, and you'll be hearing from both of us today. We are delighted to be back. Some of you are familiar faces. I think some of you were at our dialogue in November when we started this whole process. And we came to Jackson and talked to a lot of people, both working in healthcare and other sectors, about Affordable Care Act, about the implementation, about what was coming, and how we talk to Mississippians around the state about this. And so what we're going to do today is talk to you a little bit about, Corey's going to talk to you about what's in that act. We're going to talk to you about what we heard from people across the state. And then most important is we're going to give you a chance to talk, because it's really important to Mississippi Health Advocacy Program and to us to hear from you about your response to what the public had to say, how it jives with the realities all of you face, and what they need to take away as they continue to do the work around implementation, which is going to be pretty all-consuming over the next few years. So to that end, the agenda is we'll start with these introductory comments. We're then going to hear 2 presentations, both from Corey and from Bella, about the work that we've done. We're then going to have a working lunch, and you'll be working in groups, and we really hope you do stay because it's so important that we hear from you. Over that lunch, we're going to be talking about 2 questions. The first question is, given what you have heard about what the public says, in particular around healthcare exchanges, what do you think makes sense? where might you vary from what the public thinks makes sense for healthcare exchanges and healthcare reform? Because a lot of you are dealing with the everyday realities around healthcare, around some of the issues that your constituents face, and we want to know what you think, how you react to what the public, who has had very little experience with this stuff, has to say. The second question, and this has come up since we did this work, is around the Medicaid expansion. When we did this work, the assumption was if the Affordable Care Act was upheld, that Mississippi would participate in that Medicaid expansion because they would have no choice if they didn't want to lose their funding. But that's not true anymore. The Supreme Court now has said states have the option. So we want to talk to you about, given where the public is, what the need is, what do you think about this Medicaid expansion? How do you think the public would feel? How would your constituents feel? And what are the key points that we need to be taking away from that discussion? So those are the two questions over lunch. We'll then come back and hear from the tables, and we will get you out of here by 2 o'clock. We want to just take a moment and maybe do this at your tables for about 5 minutes. Just talk to each other a little bit. To each person, take about 30 seconds and talk about, when you think about what's coming with implementation of this healthcare reform, what is something that either really excites you or really worries you? So when you think about this, what are the things that really stick out for you as either tremendous potential benefit or real concerns, real worries? And what I'm going to ask is that at the end, one person from each table just take a few seconds to present to us what were the major themes that you heard at your table, the real concerns and the real benefits that you think may be coming down the pike. After that, we're going to go around, and we've been doing this. This is our fourth sort of interactive briefing that we've done. And one of the things we've done, which has really been fascinating, is we've asked each person to come up with one word. And many people hyphenate and use a lot of punctuation, but one word that describes where you think Mississippi is going to be in terms of health care in 5 years. What do you see coming? One word. Okay? So we'll do that at the end. But for now, let's start with 5 minutes. Go around the table, something that either concerns or excites you, or one of each, about this coming healthcare reform. Okay? What I'd like to do is, if there's somebody at this table who is willing to just, quickly give us a few of the key things that came up in your discussion. Anybody? Yeah? Okay.
Of course, we had way more concerns than we did benefits, but we'll tackle that, I guess, as we get deeper in the discussion. But the benefit that we did talk about a little bit was that the parents were able to keep their kids on for a longer period of time, as far as 26. But that's if your parents want to carry you, so that can be a concern as well. But basically, our three concerns, they all filter back into one. Many of the health problems, because of people not having health care or not getting health care in the past, we might not have enough doctors. And what if they deny those people as far as, well, you have too many problems as far as preventatively. So that was one concern. And that was children as well as adults, because a lot of kids don't get seen as well. So the individual mandate for either low or poor income families, whether they're actually going to buy into the Affordable Health Care Act, whether they're going to get insurance, as well as purchasing. Some businesses are refusing to purchase insurance because they'd rather pay the fine. So
businesses, smaller businesses,
right,
but large enough to have to purchase insurance,
right,
you think may back out. Okay, great, thank you. Who's going to talk from here?
One of the excitements I will share that we had was preventive care. So it's in place in a lot of places with insurance, preventive care, those things, the mammograms and the things that the physicals and things that you need to get done. We're also concerned about how this will affect insurance cost. And two of us were witnesses to the prices that you pay already for insurance costs. How is this ACA going to affect the insurance costs? Was one of our concerns and our excitement.
Okay. Great, thank you. So real potential, but also some unknowns there, right? Okay. Come over here. Thank you.
Good morning. I'm reporting for our group. Each person shared whether they were excited or had some fears or concerns. And this is an overview of it. The excitement is that Mississippi will have a chance to be seen in a different view, a different image, based upon the statistics. We're also excited about this will be an excellent opportunity for small businesses that otherwise could not provide any type of health care insurance for their employees. Although they may not be able to provide full benefit, they will be able to provide some. Also excited that some individuals that have several different part-time jobs but still do not make up enough monies to cover insurance benefits for themselves will have access to some type of benefits. Another excitement is there will not be any caps on individuals that have pre-existing health issues. This will also be an opportunity to add additional physicians in areas that do not have physicians there readily available, as well as there will be an increase in the access to primary care, for example, in the community health centers. Along the lines of fears or concerns, we are concerned about the side effect as it, when we reference it as side effect, we're talking about maybe the elderly may end up having to suffer from some of their benefits. So our thoughts would include Mississippi would have to be innovative in making sure that our dollars are channeled in the right area to take care of the elderly. And the other concern is that, as in most places, Mississippian will probably have some resistance to change.
Our group had kind of two areas of concern. In terms of the effect on small businesses, there's concern about the cost of insurance purchased through the exchange, and a perception and a thought that seems to be supported by some CBO data that shows that small businesses could probably do a better job just going it on their own and combining across state lines. So just some concern that maybe the government didn't heed recommendations of the small business community when designing the exchanges, and that the ancillary effect of that is going to be to increase cost on small businesses as a result. The other area of concern at our table was the Medicaid expansion and just kind of uncertainty about what the state's going to do, what the governor wants to do, and what will happen as a result to special populations like, you know, children who are maybe aging out of Medicaid, children with special needs. Like, how are we going to cover those populations? So, did I cover that? Okay.
Let's do this lightning round now, because again, we have had such a range of reactions, and it really does help us to understand where the room is. So we're just going to go around one word from each of you that describes, if you had to pick what really describes for you what's happening in 5 years from now, what would your word be? Mind if I start with you?
Change.
Change.
Expansion.
Expansion.
Access.
Access.
Education.
Education. Okay. Advocacy.
Creativity.
Creativity. Okay.
Uncertainty.
Uncertainty. Access also.
Dead.
Dead? You? I hope not. Okay, no. You get 2 words. You can have another one too. Health. Expansion. Complexity. Okay. Coming over here. Sustainability. Okay. Integration. Available. Okay, Bella. Write faster. Okay. Okay. Wellness. Concern. Okay. Cost. Different. Good. Okay. Stagnant. See, you get opposites here. This is good. Okay, good. Dorothy. Knowledge.
Willingness.
Okay. Willingness. Great. Availability. Healthier. Great. Progressive. Okay. Progressive. So there's a real range there. I mean, people really are, there's some hope, but there's some real concern about how this is going to go. And I think concern particularly about how Mississippi is going to adopt it, and your workforce issues, I think, are huge, and we've been hearing that every place we have been, that you could have insurance for every single person in Mississippi, and if you don't do something about your workforce issues, then your access is not necessarily increased. So there are many, many issues to this. Corey's going to take you through now sort of a primer on the Affordable Care Act and what we've done, and then Bella's going to give you a more in-depth look at these choice dialogues, okay? So I'll turn it over to Corey.
I'm going to take about 10 minutes or so to talk about this, and it's going to sort of be a very brief overview. I know some of you all are maybe a little bit more familiar than others. So just briefly, the law itself, which is actually called the Patient Protection and Affordable Care Act, was passed in March of 2010. In terms of healthcare legislation and health policy, it was the most significant piece of legislation since Medicaid and Medicare. But what ACA does, it seeks to address issues of access to care and also the rising costs of health care and health insurance. And it does it through a couple of different ways. What we'll talk about mainly today, and you heard a lot of talk about, is around coverage expansions, talking about the expansion of Medicaid and the establishment of health insurance exchanges. In health insurance exchanges, the easiest way to sort of describe it is when you think about a marketplace to purchase health insurance, where a group of private insurance companies compete for your business. The simplest way you think about it is if you were traveling to Memphis and you were looking for a hotel and you put in information about the night, how long you're going to be there, it'll shoot you back some information back on the internet in terms of maybe from Expedia or somewhere, your hotel options, your choices, and then you can sort of decide, well, what I want to pay, and then you can decide, well, what type of, what brand, do I want to stay at a Hilton or a Hampton? So take that sort of thought process and let's talk about health insurance. What you'll do is you'll be able to go to a place and put in information about yourself and your family, and you'll be given some insurance options from different plans. You can look at those plans and decide, well, how much do I want to pay in my premiums? How much do I want the insurance to cover? That's what the exchange is. It's a marketplace. Also, there are some things like in terms of the law itself, health insurance reform, some changes in our healthcare delivery system. Also, it has some prevention and public health initiatives. This law is actually a law that's implemented over time. So some of the benefits that people are currently taking advantage of now, for example, I think someone mentioned, young adults being able to stay on their parents' insurance until 26. Things like seniors receiving rebates to help with their prescription drug costs. So those are things that are currently in place, but a lot of the work, when you look at it, particularly around the expansion, we sort of lead up until 2014. So, sort of talking a little bit more about, the coverage expansion and how does this work. This is a chart here that I use to sort of describe what's happening and what's going on with this law. So sort of you see here on the base, you have employer-sponsored insurance. So for those people who receive the health insurance for their company, this doesn't at this point necessarily impact you or affect you. What it does is try to reduce the number of uninsured, and it does it through two strategies. One strategy is the expansion of Medicaid up to 133% of the federal poverty level. That's up to about 14,000, 15,000 for an individual, about 29,000 for somebody, a family of four. So what if you sort of don't fall in that cutoff? What happens then? What are your options? Then that's where the health insurance exchanges actually come into play for those people who are above that cutoff for Medicaid. So that's how you sort of approach this idea of reducing the number of uninsured. So this is some data here sort of actually putting that into numbers in terms of Mississippi. And this is data from the Center for Mississippi Health Policy. And it shows here in this first pie chart, you sort of look at where people currently in Mississippi get their health insurance. So we have about 48% of Mississippians who actually have employer-sponsored insurance. Medicaid CHIP is about 22%, and the number of uninsured is estimated to be about 20% here in Mississippi. So what happens when ACA is fully implemented? You can see here the chart, sort of the second pie chart here, the coverage shifts. You see the expansion of the Medicaid CHIP population up to 32%. You have the exchange itself covering about 11% of people, and you still have about 7% uninsured. Well, the people who will be left uninsured is a couple of different reasons. There will be some people who will receive an exception based on their income, who can't afford the coverage even even sort of with the Medicaid and with the exchange itself. But it also account for people who maybe, non-citizens who still may be uninsured here in Mississippi. So what does that look like in terms of sort of getting down to the number, moving past the percentages? So you're looking at in 2014, it's estimated about 270,000 people will be added to Medicaid, looking at sort of annual expenditures at about $1.6 billion. One of the things also to point out too is when you sort of look at the numbers across time from 2014, 2019 in terms of expenditures, you're looking at about 11.4 billion, with the feds paying on average about 97% of the cost. So what does all this mean? So, right now, Mississippi in terms of Medicaid, the way it works is the state pay a portion of Medicaid and the feds pay a percentage of Medicaid. So right now, Mississippi actually have one of the highest Medicaid rates in the United States. But what happens is the first 3 years of ACA implementation, the feds will pay 100% of those costs for Medicaid for the first 3 years. After that, that match rate starts to decrease down into 2020 to a 90-10 match. That means in 2020, the state will pay 10% of those costs and the feds will pay 90% of those costs. Again, sort of putting numbers behind the percentages, when you look at the number of people who would actually be able to purchase insurance on the exchange in Mississippi, you're looking at about 275,000 people. Now, of those people, about 229,000 will be eligible for subsidies. So, for example, I sort of talked about that cutoff when you sort of, don't qualify for Medicaid, but you are able to purchase insurance from the exchange. Based on income, if eligible, you'll be able to receive a subsidy to help pay for that coverage if you purchase your insurance from the exchange. One of the things I like to add to this and sort of talking about this, we always talk about the uninsured and this population that'll be impacted or affected by this. I just have a couple of slides here that sort of, breaks that population down and shows some sort of numbers behind it. This is data also, the next couple of slides is data from the Kaiser Family Foundation. But when you look at the people who are uninsured here in Mississippi, most of those people fall between the ages of 18 and 65. But 81% of the uninsured in Mississippi are adults. 19% of the uninsured population are children. When you look at it by the distribution, sort of the total number of Mississippi residents who are uninsured by race and ethnicity, 49% of the uninsured population is white, 43% is black, about 8% is Hispanic and other, and that sort of get lumped together just based on the statistics, but also including Hispanic and also Asian population. Now, what I showed you earlier, sort of talking about the larger sort of when you look at race and ethnicity, about the distribution, that's just looking at the total number. But when you look at the rate of insured or uninsured here in Mississippi, blacks in Mississippi are disproportionately uninsured at 25% compared to whites at 19%. And this is when I love to talk about, sort of point out. A lot of times you hear this conversation about uninsured being people who don't work or don't do anything. But when you look at the data and look at the numbers, 40% of the people who are uninsured actually are people who are part-time workers. 18% of the people have at least one full-time worker, and only about 29% of people who actually are not working. And when you look at it by race or poverty level, as you expect, as your income increases, the rate of uninsured actually decreases. So for people living below the poverty level, make up about 34% of the uninsured, 33% who live under 139%, and it decreases all the way down to 8% in terms of people who live 400% above the poverty level. So I know that was real brief and real to the point. Just in Jackson and other places, people have sort of talked about this in the sense of with ACA, it's not necessarily just about advocacy, it's about education. And once people really learn and sort of deal with what's in the bill, people start to understand and realize how this is good for them personally. As a father, what it means for you as a dad, what it means for you as a mother, if you're a small business owner. And they look at it as an opportunity to support, grow their families, and support their businesses.
Viewpoint Learning worked with the Mississippi Health Advocacy Program to talk to people around the state about the Affordable Care Act and the patient protection, and to really learn what the public thinks about healthcare exchanges in particular, how it's going to affect their lives, what they want to see in terms of a healthcare exchange, and how the Affordable Care Act is going to change things in Mississippi.
For people that don't follow it that closely, explain what an exchange is and what it's going to do for people.
Well, a healthcare exchange is going to be a marketplace for health insurance, sort of like Orbitz or Travelocity, and people will be able to access health insurance through these exchanges, and each state is going to be having one. What we found was that most of the people that we talked to had never heard of a healthcare exchange, even though many of them will be purchasing their insurance through the exchange. But it's really poorly understood, and it's something that is going to matter deeply to people, which is why we thought it was worth the time and the energy to go out and talk to people and learn what they think and to try and understand what they want out of this.
What parts of Mississippi did you survey, and how many people did you talk to, and what was their general feeling?
We were in Tupelo, Biloxi, Greenville, and here in Jackson. And in each location, we had about 45 people. It was a randomly selected representative sample of the public. And in each place, we found, first of all, people really know next to nothing about the Affordable Care Act. And it doesn't matter if they say they really like it or they really hate it. They still don't know much about it, and they're very willing to admit that. When they learned about it and talked about it, and we presented arguments for and against, really the discussion that is out in the country today, we found that people became more open, really wanted to know more, and really felt like there needed to be much more information and education for the public. Many of them saw that it could impact their lives positively in ways that they had not expected before.
How do you explain the Affordable Care Act to the average person, and in Mississippi, what it's going to mean?
Well, we don't try to explain the entire 1,500-page bill to the average person. What we do is take pieces of it. And that's why we focused on exchanges here, because exchanges is something people can immediately understand, and understand when you've got 20% of the population without insurance in Mississippi. How do you get insurance is a really critical piece for many, many people. So we really try and talk about the Affordable Care Act, not so much as how it's going to affect the system, but how it's going to affect the person in the room, how it's going to affect their family, their community. And that's the kind of information people really don't understand right now. So starting from the point of their own concerns, and the things you hear about here are access to care, the quality of care, the fact that people can't get insurance, that they can't get to specialists, pre-existing conditions. How does it affect those things? That's our starting point. And then we go from there trying to explain some of the parts of the Affordable Care Act and what it's going to do for people.
If people have questions or like more information, what should they do?
Contact the Mississippi Health Advocacy Program, and our website is www.mhap.org.
This has been the Mississippi Hometown Network, bringing you the people of Mississippi and the issues affecting our state.